Hi friends, welcome back to Health Made Simple, channel where we unpack confusing healthcare stuff with just enough humor and real life honesty to make it stick. In today's episode, it's kind of personal. My mom, 78 years old, she's a caregiver to my dad, full-time, and she's been dealing with arthritis and osteoporosis and recently fell. Unfortunately, she fractured her L2 vertebra, and what we found out afterward was shocking. She was prescribed a medication to prevent this 2 years ago, but she never took it. So we're talking about Fosamax, osteoporosis fractures, the healthcare system's blind spots, and the expensive medications she was nearly put on instead. This is your caregiver wake-up call. I'm a part-time caregiver too. And by the way, if you missed our previous video that breaks down the different fracture procedure like kyphoplasty and vertebroplasty, go check that out. But let's dive in. Osteoporosis is a condition where bones become fragile and more likely to break. A lot of people have it. Another 44 million have low bone density. So by the time you're age 50, 50% of women and 1 in 4 men will have a fracture. These aren't just inconvenient. Spine fractures can lead to long-term disability. And lucky for my mom, she seems to be faring okay with the procedure that she used to fix the actual fracture. So yeah, this isn't just a grandma thing that you could ignore until your bones start snapping like, well, stale pretzels. Meet Fosamax, the pill that could have prevented this. So Fosamax in a class of drugs that slows down bone breakdown and reduces the risk of spinal and hip fractures by about 50%. Well, how does it work? Well, it inhibits bone reabsorption. You take it once a week on an empty stomach and you stay upright because it affects your esophagus, not in a good way. And it's about $30 to $60 a month for a generic brand. Again, going over the side effects, it has GI issues, esophagus, throat irritations. So get this, my mom was prescribed Fosamax 2 years ago. She didn't remember filling it. And I didn't know she hadn't filled it. And her doctor, the rheumatologist, assumed she had. You see where this is going? We kind of all blanketly missed it. And I'm assuming this happens to a lot of patients. Given my experience as a nurse, there are a lot of times when patients just forget to fill their medication. It's quite normal. Rheumatologist thought she was taking Fosamax. When she had the fracture, he said, looks like that didn't work. Time to move on to a stronger meds. He ended up suggesting 2 stronger meds than Fosamax, one called Forteo and the other called Evenity, both injectables and high-cost osteoporosis treatment. But get this, they're injectable, but she does not want to give herself injections. And on top of it, it's very expensive medications. We're talking about thousands of dollars a month. But she never started Fosamax and no one really checked, unfortunately. And it's, what are we going to do? And this is why med list matters, and to go over it with the patient, with your loved ones, and check with pharmacy, right? Don't assume someone else is tracking it, because this is where we end up. No one was tracking it. And unfortunately, this fracture could have been preventable had she been taking the Fosamax for the 2 years, 3 years that is supposed to be prescribed for. Lessons learned, I know that we're not alone in terms of taking care of someone that has osteoporosis. My mom has the original Medicare, so she has the Part D of the pharmacy. Forteo, the one that the doctor prefers, she didn't want to take that because that would require the self-injections, going to require about 2 years. Monthly injection is for 1 year. Regardless, the medications are thousands of dollars, anywhere from $3,000 to $6,000 a month. Fosamax is probably around upwards of $60. Most doctors will prescribe the Fosamax from the beginning and to see if that works. My mom has Medicare, the original, so she has a pharmacy Part D, and these medications are so expensive that a lot of times they're not covered by Medicare. So those are things that possibly if you had Medicare Advantage, if we went through the formulary of the medications before you enrolled and you're thinking that this is a medication you need to take, it's something you want to discuss with the Medicare Advantage provider. These two medications have side effects as well. There's a dizziness, leg cramps, also joint pain, high blood pressure, and heart risk. The dizziness side effects, the high blood pressure, those are conditions that can cause you to fall, a risk for falling. Hopefully these medications work. So it's kind of a balance game, I think, in terms of these medications. They are going to help you, but then you have to realize that the medication can cause side effects. It appears to be counterintuitive. So the upgrade from a $30 pill is an injection that costs more than your car payment. So that's really an expensive cost to a NIS pill that none of us really caught on time before she got the fracture. Now, it doesn't mean that if she had taken it, that it would have helped 100%, but at least we could have tried and it was more cost effective. Now, we could have prevented a fracture for the cost of lunch out, right? $30 to $60 for Fosamax per month. But instead, all these imaging procedures, prescriptions, painkillers, all because really no one verified if the pill was actually taken. So when she fell, she needed to get an MRI, transportation to the emergency room. So really think about these medications and if you're taking it. The Procedure Act filled the fracture with the cement, and it's an outpatient procedure. He had no complication. It's a routine thing that many people do, especially if you have osteoporosis and you're prone to breaking a bone. So what does she do today? She decided to do something that required her to get on the ground, and she couldn't get up. She also did some watering and picked up a large hose. And these are things that she feels better, so she thinks she could do these things. As a nurse, I have to always keep reminding her that just because you feel better at the moment, the accident of her getting the fracture and the procedure, she should really take it easy for the next 2 months or so and really be mindful of the movement that she's undertaking after the procedure, after the fall. She understands that. I'm going to hand it off to my other siblings because I don't live close, but I've been here for the 3 weeks after her fall, getting her to the procedure and pain management and so on. Post-procedure, it's really important that you might feel good, but you're not yet 100%. Let's go back to why older people skip Fosamax. Well, the instructions are complicated and there are side effects that's uncomfortable. You have irritation of your throat. And there may be some cognitive issue because you feel dizzy. And in our case, there was no follow-up. And as caregivers, we weren't told. Every patient, including my mom, is overwhelmed. She's taking a handful of pills. And so everyone forgot, including me. As a caregiver, as a patient, even the providers, the doctors, double check your prescriptions. When you do the intake, really check and see that you are taking the medications that you should be taking. And as a care provider, really advocate for med reconciliation. I'm assuming that because she had multiple visits with the rheumatologist, that the Fosamax medication should have come up. There should have been an intake when she first saw the nurse. But as everyone knows, the healthcare system is really broken by this example. As you can see, an important medication just was dropped. So if this is your mom, your dad, don't wait until they're in the hospital, because this truly the outcome could have been worse. So know what they're taking and that they're taking it. It really only takes about 30 minutes to go and reconcile those medications. These are some tips in taking care of your osteoporosis. You want to take some calcium, vitamin D, exercise, weight bearing, walking, yoga, resistance training, and home safety is really important. be really mindful of movement, especially when you get up to that age, like my mom and my dad. They move slow, they use a cane, they use a walker, but sometimes when they feel really good, they tend to move a little faster, and you really have to be careful. If you're a caregiver, ask the awkward question. It really is going to help the person you are helping. And if you're a patient, take your meds. And if you have a question, ask your doctor. And if you're a doctor, check the chart, like someone's spine really depends on it. And I can't emphasize the importance of exercise, particularly weight bearing, whether it's extra weight or your body weight. That needs to be started early. Now, I understand that with my parents' generation, exercise was not something that really came to their mind. We're an immigrant. We immigrated from South Korea. All the immigrant families out there, you know that when they come over to the United States, they may have 2 jobs and kids to take care of. There is no time to think about exercise. If you are a caregiver or you have a mom and dad in their middle ages and they're not working out, please encourage them and advocate for them. Exercise is probably fundamentally one of the most important things that will help you, not with just osteoporosis prevention, but heart disease as well as hypertension. I am a proponent for exercising every day, regardless what it is. Not will it help your bone to get stronger, but cardiovascular wise, it will help your heart get stronger. If this video was helpful, please subscribe, like, and check out our other video for a full explainer on RFTVA procedure and some of the other spine procedure. This is Health Made Simple, where we make healthcare suck a little bit less.